Hello, hello. My name is Jess, and this is Patient POV. And today we're hearing from Letisha, and she is a nurse, and she's also in school to become a dietitian. And she has a lot of valuable things to say. She specifically works with patients with PCOS, which is polycystic ovarian syndrome. But I think she has a lot of valuable things for anybody with a chronic illness to hear. We talk a lot about food and eating things without being afraid, and we also talk about the mental health side of having chronic illnesses, really. And yeah, I'm really excited for you to hear from her and jump right in. But just a few reminders before jumping in is that you can like and subscribe. That's always appreciated. And you can also head over to my Instagram for more updates, and I post more regularly there. And that's Jess underscore and underscore Elda, which is ELDA. And you can also head over to patientpov.ca for more information about podcasts, as well as product recommendations, the blog, and you can find lots of stuff on there as well. This is just also a reminder that this is the last episode for this before the summer, shall we say, is a good way to word it. I might do a few episodes throughout this summer. I haven't really made up my mind, but I am hoping to take a little bit of time off, just because I've been doing work, school, and the podcast, and it's just been a lot. And so I'm excited to take a little bit of a summer break. I have a vacation planned as well in that time. So I'm excited to be able to do that and take some time away from posting podcast episodes, but at the same time, I will still be posting on Instagram, and I'm hoping to get into a bit more of a regular schedule with that. And then hopefully do some brainstorming and planning for the starting up, if not doing some episodes in the summer, the latest I would come back would be September, most likely, just as the start of everything new starts. That is my that's my plan. If you have any suggestions on who you want to hear from as well, or any medical conditions you want to hear from, or any medical professionals, please send me either a DM, or I'll put the question poll if you're listening on Spotify, or if you're listening on YouTube. Please comment who you want to hear from, either people specifically, or conditions you want to hear about, or medical professionals you want to hear from, whether it's specific people or just their department or people's department or whatever. You let me know, and I will try my best to fulfill that. I'll also put a poll up on my Instagram in case anybody wants to vote there as well, or comment what else you'd like to hear from. Um, yeah, we'll leave it at that for today. I do want to say a huge thank you to everybody who's listened, whether you're listening in new today or you've been following along since the beginning of this podcast. I do want to say a huge thank you. And I look forward to seeing what happens with patient POV as time goes on. So, as always, thank you all so, so much. And I hope you have a great week ahead. Hello, hello. How are you?
Hi, good.
Good, good. Do you want to just jump right in and give us an introduction on who you are, your health journey background, what you're doing now, all that good stuff?
Yeah. So my name is Letisha Bates, and I have the diagnosis of polycystic ovary syndrome, also known as PCOS, which has really inspired my career. I've been a licensed practical nurse for 15 years, and for about a decade, I worked in skilled nursing, and I was experiencing some health issues at the time, and the more I dug into it, the more I realized that my PCOS was really impacting my health in more ways than I had initially realized. So I was on a health journey and was already transitioning away from nursing and going into health coaching. I left the nursing field, started my own health coaching business, and just naturally I started working with people like me who also have PCOS. And I got more involved in that space and was looking for more education, more advocacy work. And I saw dietitians who specialize in PCOS, and I saw how vital they were and the impact that they were making. And I think also too, with my nursing background, I went from a field that has a scope of practice and code of ethics, and like you knew what your job, entailed, where health coaching is like the Wild West. Like there's not any rigid lines. And I think with my healthcare background, I always keep this in my head of like, okay, like if something was to happen and I went to court, what grounds do I have? Like, am I doing things outside of my scope? So, anyways, I thought, you know what? If I really want to be in this space and I really want to play a role in helping people with their health, then I need to go back to school and gain the education along with the scope of practice. And so I enrolled in a dietetics program to become a dietitian. I now have my bachelor's degree in nutrition and food science. I'm currently working on my master's degree and start my dietetic internship this summer. So hopefully this time next year, I will be a dietitian, and my goal is to open a private practice that specializes on women's health.
Amazing. Yeah. Thank you so much for that good overview. I know you mentioned PCOS is polycystic ovarian syndrome. Could you just give an explanation of like what it is, kind of what the
Yeah.
trademark symptoms are, and how it affects people's lives?
Yeah, yeah. So PCOS is this like complex beast of a endocrine disorder. So it does impact our reproductive system, our hormones, all the way through mental health. Like it really impacts the entire body. The main features of PCOS are usually fertility issues. Period irregularities, difficulty conceiving, or androgen excess issues, which would be those male trait hormones that lead to symptoms like acne, hair loss on our scalp, but then hair growth on our body and face. Sometimes it's weight management struggles. And the challenging part about PCOS is it is a diagnosis out of exclusion. So, what I mean by that is to get a PCOS diagnosis, you kind of have to go through and exclude all other possibilities. Like hypothalamic amenorrhea is losing your a lot of people like maybe that struggle with eating disorders or in a low body fat percentage or under eating for a long period of time may lose their period. Doesn't necessarily always mean that they have PCOS, even though they have a symptom of it, if that makes sense. So you
Mm-hmm.
have to exclude everything first, which sometimes is really challenging depending on what kind of healthcare support you have. And then once you've excluded all the other possibilities, then you have what is known as the Rotterdam criteria for PCOS. And this is the most globally used criteria for PCOS. And unfortunately, it's not a situation where you can just go in and get some lab work and they say negative or positive. You have to present at least two out of the three criteria qualifications. So, out of the three, there is ovulatory dysfunction. So, this is typically those who are troubling to conceive, not having periods, sporadic periods, or maybe their periods are never ending. It can look like a lot of different things. Typically, it's tracking your cycle is how you're going to know whether or not you're experiencing that criteria. The next one is going to be the androgen excess. There's two different ways that a provider may look at that. Sometimes it may be through blood work, so they may check your testosterone, DHEAS, like those androgen hormones, and see if they're elevated. But some providers can also go off of your symptoms. So if you're already presenting with hair thinning, facial hair growth and acne, then they may go ahead and just consider, hey, you're obviously struggling with some androgen excess issues. The last one has actually recently changed, which is really exciting because they've made this one a little bit more accessible. But previously, it was just evidence of polycystic ovaries, which you have to have an ultrasound to be able to see if your ovaries have multiple cysts on them. The other option is to get your AMH levels, anti-Müllerian hormone levels checked, which can kind of indicate whether or not you may have had like multiple cysts. Are you actually ovulating and releasing those eggs, which is a lot cheaper option. It's a lot cheaper to go in and just get your AMH levels done. So now that's added to the criteria, but essentially once you exclude everything, and if you're at least hitting 2 out of those 3, then you would essentially qualify for a PCOS diagnosis, which your provider could then initiate and then start talking about treatment, which is really, really important. Something, and PCOS is really complex and it can sound very just Debbie Downer. And so a lot of the information is like really not fun to talk about or hear. So I don't want your listeners or anyone who is, following along to just get really depressed. So I'm going to try to be optimistic and empowering. But what really happens a lot of times is PCOS is treated like a fertility issue. So they're just like, here's some birth control, lose
Mhm.
weight, come back when you want to get pregnant. What patients are not being told, this is actually a lifelong endocrine disorder that has no cure. So even past menopause, even if you have a child or don't have a child, you're still going to struggle with PCOS. And what a lot of people don't realize is it contributes to some really serious health risks like cardiovascular disease, type 2 diabetes, non-alcoholic fatty liver, mental health conditions. And so if you're not really getting to the nitty-gritty of managing your PCOS diagnosis, you could potentially be looking at some of those other diagnoses in the future. And it's so frustrating because those sometimes can be preventable if you have the right treatment and lifestyle plan. But for a lot of patients, it's a little too late. They're already diagnosed. Actually, the type 2 diabetes, it's like 50% will be type 2 diabetic or pre diabetic by age 40.
Oh, wow.
So, you're seeing a lot of patients, I forgot what the most like recent statistics is, but it's like 5 to 7 doctors over 5+ years sometimes to get that diagnosis.
Mm.
And then it's really up to whether or not your healthcare team is supporting you in your diagnosis and you're actually addressing some of the mechanisms that contribute to PCOS to reduce those health risks down the road.
Yeah, for sure. When we talk about, like, women's health in particular, I typically hear about, like, endometriosis, and that's the one I've talked about a lot, in terms of, like, it takes, like, 10 years or something like that to get diagnosed, but I didn't realize how difficult it was for PCOS to get diagnosed as
Mhm.
well and how, like,
Yeah.
long it takes.
Yeah, that can be really frustrating, and you'll also see people who have that overlap or they'll have
Mhm.
on both. And endometriosis is just, it's a painful condition, and it just seems so frustrating that you're constantly having to go back to the doctor. And I know women who have just been bleeding for nonstop, large amounts, and you would think in any other scenario this would be something that we would be like critical care and and really jump in. It's really frustrating. There is a lot of um, like I don't want to say misconception, but like there's a lack of consensus, like globally, of providers, and so I never like there are some really amazing doctors out there that are trying to change that narrative and trying to educate other doctors and healthcare providers. Really, it's kind of a thing unless you make it your specialty. It's hard to like, you don't typically get this kind of education in nursing school or, and like as a dietitian, you don't really learn there's like a paragraph about PCOS. So unless you actively like seek out that education as a provider, it can be kind of challenging to know a lot about it. And this is something that I always encourage my followers or anyone that I'm talking to is it's okay if you have to educate your provider, like your doctor.
Mm.
Like you may have a doctor that even though they may treat PCOS, like they don't really know like the nitty gritty about it. And it's okay to be like, hey, here is the international guidelines for treating and managing PCOS. I saw this in there or whatever. It's okay to do that. A lot of having PCOS and endometriosis is like you have to do a lot of the legwork yourself. You have to do a lot of the digging and the research and really use your voice to advocate for what your healthcare needs are.
Yeah. And if you're going into a situation where you've maybe had some like medical trauma in terms of like you've been kind of gaslit or like those
Yeah.
different things where you kind of get stressed going into those appointments, how do you like what advice do you have for people in terms of like being able to speak up while having that like anxiety going into the
Yeah,
appointments?
that's a really good question. I feel like in the PCOS space, this really happens a lot
Mhm.
around weight bias. So because PCOS, a symptom of PCOS is typically like weight gain or difficulty losing weight. And so a lot of us are experiencing that in our healthcare settings, and that really like deters you from wanting to go back or I can't tell you how many stories of women of like, I haven't been to the doctor in years just because like I don't want to have to go through this weight situation, and it's not because I'm not trying, and that's like a really, really hard thing. So I always suggest, and like this is the case even if you're meeting a new provider and you don't know what that situation is going to be like, really prepare for that appointment. So really dial in what needs you have that need to be met, whatever your symptoms are that you really just need to address. Go ahead and like have a plan of action of like I've been doing X, Y, and Z to try to mitigate this symptom, so that you can share that with them, and really just go in there with all of the information that you possibly can. I'll just give like a personal testimony and
Yeah.
example. My last OBGYN appointment, I was really like I really got to find someone that's going to work with me that isn't going to dismiss me every time I turn around. So I came in, and even though I gave all of my previous lab work, I had like 5 years worth of lab work, my medication list, my symptoms list, what I did, all in a folder. I gave one to the nurse, and I also gave one to the provider when they came in. And I kind of set the stage by saying, thank you for taking the time to meet with me. And I know I'm a new patient for you. I just want to quickly share that, this is my background. I have been dealing with this condition for a long time and I keep getting dismissed. I hope you're the provider that's not going to dismiss me today. And kind of
Mm.
just like go ahead and set that tone. Because I think what happens a lot, and I even noticed this like from my years of nursing, a lot of times it's the patient, like you're kind of like you let the healthcare provider kind of take the lead, like when they come in, you kind of let them like start things and say it's okay for you to take the lead and set the tone of that visit. You're paying for it if you want to look at it like that,
Yeah.
like it's your appointment, it's your investment, you're paying for it. And then I think that there are some additional things because what typically happens is especially with the weight bias, it's like you're like, okay, if you can just lose weight and come back and we'll see if your symptoms change. That one's a little bit different because perhaps you've been working on weight loss. Maybe you have lost weight. I'd actually lost 100 pounds when I got to my sickest. And my doctor was like, just keep dieting and exercising. And I'm like, that's not the answer. I've lost 100 pounds. What more do you want from me? I'm really sick. I need your help. So yeah, like that could definitely, like, speak up, and it's okay if your voice shakes, it's okay if you have tears in your eyes, um, it's okay, but you have to speak up because you are your best advocate. Because if you don't speak up, no one else is really gonna do that for you. So share with them, like, "Hey, I've lost X amount of pounds," or, "I'm doing X, Y, and Z. I'm working with, a dietitian," like, whatever that looks like. Another tricky way to, like, talk about that conversation is if they're only wanting to prescribe weight loss to you, one, maybe you have tried everything and you need some more help. There's nothing wrong with that. We have medications and treatment options available now. Maybe that's something that you need to discuss, and that's a great time to bring that up and say, like, okay, well, like, what are my other options? Another thing that you could ask is like, all right, if I was at whatever weight you want me at, or at whatever BMI, whatever
Mm.
scale or statistic or number that they're using, and I still have this problem, what do we do then? Because
Mm,
whatever that is, odds are you can go ahead and implement that now. That's a really great way. You can phrase it however it feels best to you. But if I hit whatever goal weight you want and we're still struggling with this, what do we do then? You'll ask those kind of questions. And I don't think I knew that really until I got into like advocacy and like was being around other providers, because I even struggled with that. And even as a nurse, like it's really it's an emotional experience, and
mm.
it can get really scary. Other things that you can do, I'm just going off of common scenarios that I hear. A
Yeah,
lot
for
of
sure.
times patients will go in asking for like full lab panels, like good comprehensive hormone panels and so on. And doctors are not, uh, wanting to prescribe it. And there may be a reason. So always ask. There may be a reason. It might be insurance coverage, might be a lab thing. They may have an explanation. So ask why they don't want to draw those labs that you requested or whatever treatment option is that you requested. And then if they don't really have a good response and you didn't come to an agreement, then you can say, well, I still want to request them. If you're not willing to do that, I would like for you to chart that I requested and you denied.
Yeah. There was somebody else I think it was at the beginning of when I first started this podcast. She also said that that was her number one thing that she does is
Mm.
ask to make sure they chart it, because then there's like proof and then there's like a liability if it does come
Mhm.
out being positive if you ever get it again.
Yeah. And I'm a much I want like I've been working in the PCOS space since I guess 2019. It's been a few years now, and I do a lot of advocacy work, and so I am speaking out for like a lot of people, and
Mm,
so that has definitely made my voice stronger,
mm.
and like I'm more confident in like having those like hard conversations, but I don't want it to ever sound like I'm trembling inside still, even with my knowledge, my experience. I'm trembling inside, but something that I have just learned over the years is, also following up. Like if I told my doctor, like, hey, I requested those labs, you didn't give me a good enough reason. I need you to chart that I requested them and you denied that. I would later go back and even ask the nurse that was assisting them to double check and make sure that or her, whoever the doctor is, that they did that. Like I would follow up and be like, I want to make sure that you did this. Because I'm just that like I just have been gaslit so long that now
Mm.
I've kind of got this like mama bear instinct where I'm like coming in and I'm like, no, we're not going to be treated this way. Like I'm not going to just have to keep going down this road. And then also too, there may come an instance where you just need to find a different provider. And I think that's what's really frustrating, probably in the endometriosis space too, is like you're exhausted, you're tired, it's so much energy to have to keep re-explaining your story all over again. And you're also like the morale's going down because you keep, getting closed door after closed door. But if anything that I say today stays with you, it's please let it be understanding that you are worth fighting for. So yes, it may take you years, it may take you several providers, but it is so worth it, and your health is so important, and you are so worth it to find that provider that will work with you. So sometimes, and in a lot of cases, it is you're just gonna have to go and find someone different. I know, like in Canada, that's a little bit more difficult than it is here in the States. So there may be some like parameters there. I know that there are some circumstances of like, hey, I don't have any other option. And so in cases like that where it's like I don't really have any other option, my provider is not meeting all of my needs, I still have some things that need to be met. There are so many providers that help with PCOS. PCOS is complex. It's heterogeneous, so it just shows up differently in different people. And so there are definitely doctors out there. There's different types of doctors. You have OBGYNs, general medicine, endocrinologists, dermatologists, psychologists, like
Mm.
whatever your needs are. There's different types of doctors. There's also non-doctor professionals like dietitians, occupational therapists, physical therapists. There are, licensed clinical social workers with the mental health, like nurse practitioners and PAs are a big one now. So like you may need to create a healthcare team to
Mm.
get all of your needs met. And that may change across your lifespan because what your symptoms are in your 20s with PCOS can look drastically different in your 40s. So, when you can just, create an actual like healthcare support system there.
Yeah, that's wonderful as well. I am just wondering, you kind of mentioned a few times that you do some advocacy work. What type of advocacy work do you do and what is it for?
Yeah. So in 2019, whenever I was getting more involved in the PCOS space, I learned of this nonprofit organization. It's the largest PCOS nonprofit called PCOS Challenge. And that this was right before the pandemic. So they had an actual like on the ground in person symposium, which was 2 or 3 day event where there were so many healthcare providers, professionals, researchers giving lectures on different PCOS topics, and you kind of got to like pick like what you wanted to go to and so on. So I went to that as a patient because I wanted to learn more, but also like I wanted to like how can I help people with PCOS a little bit more. And I just got really involved with that organization. Each year they also host an advocacy day, and what that is, and this is something that I'm so passionate about because I didn't realize this was a need until I got into it. Um, Advocacy Day is where the organization gathers volunteers, advocates. So this is PCOS patients and providers alike to meet with Congress members all over the US to talk to them about the need for more funding so that we can have better treatment options, healthcare access, research, awareness, and so on. So, for example, I'm going to use a lot of people with PCOS now recognize September as PCOS Awareness Month. That was not just a social media campaign that took off. PCOS Awareness Month in September is nationally designated because of these advocates going to Congress members and saying, hey, we really need to get some attention. This part of the health space is not getting the care they need. They're being overlooked. Let's make September PCOS Awareness Month. And it takes representatives from all 50 states to agree to that resolution
Oh,
before
wow.
you can even make that designated. And it has to be fought for every year. So it's not like a one and done situation. Additionally, the other things that we have fought for are things like the patient focused drug development meeting with the FDA. Right now, PCOS does not have a drug treatment option that was created and intended for the specific treatment of PCOS. We're typically getting prescribed things that also can kind of cover PCOS. So that's like been encouraging that. It's also encouraging policymakers to increase funding to the NIH, which does a lot of our research. Oh, what people, and this is especially now in our political climate, no one likes to talk politics. It's not my favorite topic either, but I did not realize how political my healthcare was
Mm.
until I got involved in PCOS advocacy. I really had this thought at one point in time of like, so many people, millions of people have PCOS. We're all struggling with it. No one seems to be helping us. Like, why is nobody doing anything about this? And getting involved in advocacy, especially on a legislative level, made me realize like there I can become someone to do something about it,
Mm.
but we have very few people that are doing something about it, and we are so behind on the ball. Actually, no one really brought PCOS up to Congress in a big way until 2017 with the
Mm.
help of PCOS Challenge. So that just
Wow.
tells you how many years like that Congress is just now starting kind of to be like, oh, okay, PCOS. I've been doing this for 5 years. I've noticed from like my first session. So I live in the state of Tennessee, and I typically lead the state of Tennessee. So we need advocates in all 50 states, all US territories. We have yet to have an advocacy day where there was someone in every 50 states being like representing their states. Usually, like we'll have, even though I'm in Tennessee, I may cover Illinois, I may cover Kentucky, I may cover North Carolina, and meet those representatives for their state as well. So we always need more advocates to get involved. But I will say, from the first year I went in, I usually always ask, like, do you know about PCOS? Have you ever heard of it? Do you know anything about it? To more recent years, they know what I'm talking about when I come into the room. So that just tells you like it's growing. They're becoming more aware. These efforts are working. Research is increasing again because of this. But it's just going to take a lot of work and a lot of advocates to really pull through to keep that like needle moving.
Yeah, for sure. So, yeah, so if people wanted to get involved and wanted to help with that organization in particular, or just like help with any advocacy, where
Mhm.
should they go or what can they do?
Yeah. So, what I would recommend is going to either these organizations' websites or social media pages. Follow them and kind of like consume their information, see what you align with most. PCOS Challenge. There's also PCOS AA here in the U.S. In the UK, there is Verity. So, like, they're slowly kind of popping up across the world. So depending on your location, you may or may not have an organization. Another thing is because PCOS kind of covers um, so many different areas of health. For example, if the fertility side of it is really important to you and really connects with you, there's also like reproductive organizations out
Mm.
there, like Resolve is one of them that does advocacy as well. But their PCOS Challenge does something that I think is really interesting during Advocacy Day because it's just a once a year event. They typically also give you the option to fill in a few questions and they will translate those answers into a letter and send it to your state representative as well. So it's just really interesting. But also just depending, like if you're a healthcare provider, I know like nurses and dietitians have advocacy groups sometimes that go and meet the local representatives in their state. There's lots of things to get involved, but I do think that legislative advocacy can be really scary for a lot of people. It sounds really, especially if you're not like, for example, when I got into legislative advocacy, my first training session, I was in the middle of it Googling words because I was like, what the heck does a caucus mean? What's the difference between legislation and bills? And like, like that just wasn't my knowledge at the time. Advocacy looks like a lot of different things. And so, other ways that I got involved in advocacy was sharing education on platforms like social media, podcasts, like being here today and agreeing to like continue raising the volume on the topic. Advocacy can be standing up for yourself in your doctor's office. Maybe that's as far as you've gotten, which is a great accomplishment. Maybe it's sharing your story from your perspective. There's lots of ways that you can be an advocate that doesn't require, getting involved if that seems like a little too much or so on. But you'd be surprised at how many like PCOS related events and fundraisers and things like that are going on. Once you start looking for them, you'll definitely get in the hang of like connecting and networking, which is another great thing. Because advocates that like we typically will share that information like, hey, we need volunteers, we need advocates in this space, your voice needs to be heard, that kind of thing too.
Amazing, yeah.
Mm.
And then switching over to you in particular,
Mhm.
I know you're saying you were going to school, you have the coaching, you have advocacy, you have a child. And so, like, what would a day in the life look like for you, and how do you implement like healthy habits as well throughout your day?
That looks different depending on my life season. So, just a little bit of like a background, like how
Mhm.
I was diagnosed with PCOS at 23. I already had a son, who was a surprise. My first son was a surprise. I honestly didn't know that I could get pregnant. I didn't know I had PCOS, but some things just the math wasn't mathing, and so I was surprised whenever I had him. Then at 23, I was dealing with some issues, and my doctor said, "Well, you have PCOS," and it was really just presented to me as this is why you've always struggled with your weight, and this is why you struggle with your period. So when you're ready to get pregnant, come back so we can talk about it. And that's what I did. I didn't Google it. I didn't really look into it. I just lived with it like I don't know if that's the denial phase. You kind of go
Mm,
through like the phases of grief after a diagnosis,
yeah.
but I didn't even look into it. But then my husband and I were wanting to have our second child, and then so I went back and was like, okay, what are our options? And I got a little bit of help. We conceived relatively quickly, which I feel very fortunate for. And then it was after I gave birth to my second son, I reached my heaviest weight. And so, being very honest, I was just setting off on a weight loss journey. I knew that I had this condition that was kind of like the reason why I struggled with my weight. But um, I was kind of at the point in my life where I've already tried everything. I've been dieting since a young child. I've also struggled with an eating disorder. I've done everything, all the fads, all the gimmicks. This time I wanted it to be for real and I want it to be long lasting. So I kind of took the approach of like, I'm just going to slowly start changing things. I literally just started by walking, which was hard for me at the time, and then also like just eating like fresh fruits and vegetables and stuff like that. So it was like really slow progress and I just kept building. And then eventually I lost 100 pounds. I got into weightlifting and I actually competed in bodybuilding. I had like reached this physique that was never in the cards for me. I grew up obese. I'm a millennial. So let me tell you, like the 90s and the early 2000s was hard for a girl like me. We didn't have like plus size clothes back then. I couldn't go into a store and, get a prom dress. Like it was hard. So for me to be on stage as a bodybuilder just was like the impossible, right? Like I never thought that I would accomplish that. And then after competing, when I was trying to kind of like transition back into like everyday life, my body fell apart. I honestly can't even tell you all the symptoms, but I felt like it was like a novel of symptoms. Hair was falling out in chunks. I was so weak. My body composition was changing. So even when I met my like pre-competition weight, I still had like my muscle mass was gone. I put on more fat mass. I was really inflamed. It was just every day was a living hell inside my body to the point that I wasn't even wanting to get out of bed. Like I was so depressed. Like I felt like everything I worked for like 5 years when it came to my physique and my lifestyle was getting ripped away from me. And I thought maybe I'm really, really sick. Like maybe something is really bad wrong with me. And that's when my doctor was like, "Oh, you're doing great. Just keep dieting and exercising." And I was like, "You know what is PCOS? Let me look into this. Like, let me figure this out." And that was also while I was transitioning into health coaching and stuff at the same time. So typically, what I have noticed even since then and, like, really fight it took me about 3 or 4 years, like, fighting to get my body back into just a normal, typical, healthy state after going through, years, and a lot of people think it was the bodybuilding. That's not the case. Maybe it, like, tipped it over the edge, but I dieted consistently for about 5 years, which nobody talks about how you're not supposed to constantly underfeed yourself. We
Mm,
always hear like eat less, eat less. No one ever says like, hey, like that's not healthy for you and your hormones if you constantly stay in a diet. I was definitely over exercising. And what I have found is really challenging is like you can't win because when I was living in a larger body, I got criticized for that. Then, whenever I did what my personal trainer told me, I did what my doctor told me, I lost the weight, I was, living the fit life. I was, getting all these followers on Instagram because I was hashtag body goals. And then whenever I was like trying to regain my health after that, I would get blamed for, well, you didn't do it the right way. You didn't do it the healthy way. And it's like, I did it the only way I know how, which is what everybody was telling me to do. So it just doesn't matter. It doesn't matter what you do, you can't win. But a typical day, fitness is still really important to me. I love weightlifting and walking. Those are my two favorite workouts. So those are really important to me. And then nutrition, obviously, as someone who is spending 6 years of their life studying nutrition, is a big thing for me. I am finally in a place where I'm not a restrictive like I don't restrict specific things from my diet. And I really like try to balance. I focus a lot on fiber.
mm,
Fiber is like probably at the forefront of my mind whenever I'm creating a meal, and protein. But I've definitely gotten to the place like if I want to go out for like burger and fries, I'm okay with that.
mm.
So, like, trying to find that balance, but what I learned over the last year plus in undergrad, my situation is a little different from a lot of my classmates because I was driving 4-hour round trip commutes just to get to class. And
Mhm.
then I would be in class for 6 to 8 hours a day. I have 2 kids. My husband works offshore, so we go long stretches where he's not home. And so I also have to come home, work my job, and take care of my kids, take them to ball practice, homework, and then I still have to study and do assignments. So it became very challenging of like, where am I supposed to fit in gym,
Right.
meal prep, cooking all these healthy home cooked meals, and also be able to sleep and like have time to like so that's when I really learned like sometimes we don't have the capacity to do all the things that our body demands of us.
Mm.
And we hear the saying like get comfortable with being uncomfortable. And I feel like that gets used in the fitness space of like how to push harder through the discomfort. Maybe it's also on the other side of that of like get comfortable with the uncomfortable of knowing that you can't do all the things right now.
Mm.
But throughout that time frame, yeah, I gained weight. I was very inactive. I definitely relied on convenience foods a little bit more than I typically would because we still needed to eat. So I gained weight in that process. Even though I managed most of my PCOS symptoms, that was kind of the only thing that I had a hard time with. I knew intellectually, hey, when undergrad's over, I'll get back into the routine. Like right now, I'm back to the gym 3 or 4 days a week. I'm cooking home cooked meals all the time. I'm meal prepping again. So I'm kind of like getting back into like the lifestyle that I enjoy and what feels good to me and my body. But there was definitely that time where I couldn't do that. So I think a lot of what being on this side of things, we focus so much on like, okay, I need to change this habit to like eat this way, exercise this way. Just keep an open mind because you may not be able to sustain that all
Mhm.
the time, but still make it a part of your daily life. Fitness has never left me. I've always, like when I could, I still went to the gym. I still went for walks when I could. Fitness has always remained a part of my life. It just might not have been as higher on the priority scale as it
Mhm.
has in other seasons.
Yeah, for sure.
I
And
hope that
so
makes
I
sense. That was like a little rambled. Sorry.
No, 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 it was perfect, wonderful, thank you.
Mhm.
One thing you do say on your Instagram bio in particular is, in your coaching, you help people improve PCOS without food fear, and so,
Yeah.
like, in particular, when you are trying to, like, lose the weight, how do you not become, like, so restrictive and, like, that food fear of, like, "I can't have this one dessert or this one thing," or like you were mentioning, like the burgers and fries sort of thing, like it's not like you're eating that every day, but like how do you not be fearful of each thing you're eating?
Yeah. This is probably gonna be such a controversial answer, but sometimes I have these thoughts where if you have to go through that to get to the other side of it. Like, I've had these conversations with other professionals and like, okay, like for instance, like eating disorder professionals, a lot of them have struggled with eating disorders in the past. And
Mm.
that's why you're inspired to help other people. And so sometimes it's really hard to get to the point where you're wanting to manage your PCOS without food fear until you've went through the trenches of like restrictive diets and believing that everything is bad for you or whatever the case is. But I think that getting accurate information is probably the core of how you can kind of accomplish that. Especially now, and I don't see this changing anytime soon, like we are so information overwhelmed now. Like we have so many outlets of information compared to like before social media and the internet boom. So, and then we also, especially in the nutrition space, nutrition is like really weird field because anybody can call themselves a nutritionist.
Mm.
Only registered dietitians are the ones that like go through the 6 years and the supervised practice and study nutrition like it's their life. So anyone can call themselves a nutritionist. So you have a lot of people out there that claim that they are experts and they just don't understand the nuances of nutrition. They really practice certain dogmas of nutrition. That's like this is the specific diet that goes. And I think also too, because PCOS is so complex and we're all so desperate to like feel better, we easily fall into these traps. And what I've noticed in the last, I'm going to even say the last 2 years, PCOS has kind of become a target market because
Mm.
like we are so vulnerable and we are so desperate. So even MLMs, coaches, personal trainers, nutritionists, whatever it is, like we get targeted too. So they do things that make sure that their product or whatever they're sharing, whatever their thing is, shows up on
Monetizing off
feed.
of.
Yeah.
Yeah.
Yeah, so it's, like, really hard, and then you also have the case too of some professionals just sharing inaccurate information. Like, I'll just give, like, this is the common example. There's a big misconception that if you have PCOS, you have to avoid dairy and gluten. There's no current published studies on gluten and PCOS. It's not an evidence-based practice. That's not to say that some people don't, have, celiacs or gluten sensitivity and may have to remove it. But for the general PCOS population, it's not evidence-based to say you have to eliminate
Mm.
gluten from your diet. Same thing with dairy. In fact, I chose to research that in my undergrad, and we even won an award for it because we researched like what do the current evidence tell us about PCOS and dairy consumption, but what do the patients believe, and then where are you getting this information from? We had so many participants, and we did 14 different countries, so it wasn't just in the U.S. We
Wow.
had so many participants that was like, "Oh, I'm told I have to eliminate it, but I don't have an allergy. I'm told that it's going to cause inflammation. I'm told that it's going to make things worse." When we looked at the evidence of what we currently have, it's limited. We need more. But we actually saw, especially full fat dairy, improved a lot of symptoms of PCOS. So
Okay.
why the heck are we going around saying this? And of course, it was no surprise when it came to the nutrition sources, social media was the leading source. And in fact, when we combined social media with websites and blogs, so online sources, that made up almost 50% of where sources are coming from. And there's no like safeguards currently that protect you from getting misinformation.
Yeah.
Um, and then there's also that there's that like anecdotal experience. So a lot
Mm.
of times, like if you're removing dairy and gluten from your diet, you're probably eating a lot less processed foods. And people are like, "Oh, I feel better. Everything's better." And it's like, but I mean, like, was it really the lack of dairy and gluten, or just the fact that you like cleaned up your diet a little bit and you added more fiber, you've added more fruits and vegetables and grains and so on. So I think getting your information from very reliable sources about nutrition, and then if it's within your means, working with a professional like a dietitian or someone that specializes in PCOS that can kind of help you work through those nuances, because nutrition is so individualized and
Mm.
it's really hard. We want to box it in of like, this is all you have to do, because that would be easy. Like if there was just one diet that was like, all you have to do is adhere to this diet and your PCOS troubles are gone. You best believe I would start that diet today. I would. I would. I'd be like, yes, let's get it. But there's not a simple answer for it. And so it really just depends. But I think getting your information from reliable sources can really help you like navigate what works best for you. And then keep in mind that like when you're consuming content online, because that's where most people are getting that information from,
Mhm.
um, you may fall like in a silo, like for example, if you are maybe you're doing the keto diet and then you start looking up keto content, that's all you're going to see. So you're not going to like see outside of that perspective. And then also like creators, doctors, dietitians, PCOS researchers, and things like that, they're just giving you like bite-sized pieces of information. And it's generally like to the masses, to the general population. It's not individualized. And people kind of tend to take that. It's kind of like a recipe. Like you could give a strawberry cake recipe and someone's like, well, I'm allergic to strawberries. What do you want me to do about this? It's
Oh
like,
my
well,
goodness.
do you see what I'm saying? It's like
I've
people take
I've
things so
seen those comments too.
they take things so literally. So maybe also just like keeping in mind, it's hard when we're kind of absorbed into this like virtual world now with
Yeah.
social media, but it's just general information to like further empower, educate, and help you advocate. It may not always pertain to you. So take the bits and pieces that pertain to you and then scroll past the rest.
Yeah, no, for sure. I saw a video recently where it was like a 3-bean soup or something like that,
Yeah.
and somebody in the comments literally wrote, "Well, I can't have beans, what should I substitute it with?" And it's like, maybe it's just not for you then. Maybe this recipe is just
Maybe
not your
that's
soup.
yeah,
Yeah,
that's just not, I don't know how we got here.
yeah.
Actually, I shared a grocery list, for PCOS, and, there's a whole column of protein sources that are plant-based, and one of the comments was like, "Can you make this for vegans?" And I'm like, "It is vegan friendly, just don't buy the animal products." Like, that's all you have to do. That's all you have to do.
Yeah.
And that's okay sometimes, maybe, like, from my perspective, like, it comes natural to me. Maybe to some people it doesn't come natural. I know, like, if I do share, a recipe and it has gluten and dairy, because of that really common misconception, I usually get some feedback, and they're like, "Well, how do you make this gluten and dairy free? Can you redo this for gluten and dairy free?" And it's like, "Well, you just if you are eating a gluten and dairy free diet, you're probably already used to those alternatives, and you can typically just swap them out. You may have to play around with them." But I really becoming a dietitian, like, I'm kinda am, like, struggling with this, like, where is my identity, like, where it lies, like, in dietetics, kind of like nursing and a lot of other healthcare professions, people always wanna know, like, what is your specialty? Are you eating disorders? Are you a sports dietitian? Are you women's health? Are you diabetes? Like, what are you gonna be doing? And, I think because of my past experiences and because of the advocacy and what I've seen and, like, the need in the PCOS space, I definitely lean more towards that, like, um, I'm very aware of, like, eating disorders that's highly prevalent in the PCOS space, and so I wanna be very mindful of that. On the flip side, I also, understand that, like, weight focus is really important for some patients, but we also need to balance not having weight stigma and weight bias. And
Mhm.
I'm very fortunate to have worked in the functional medicine space, but I've also worked in the conventional medicine space. And it's like I see good things. Like, so I have this, like, identity crisis of, like, I don't know exactly, like, where I'm at, but one thing I do know is that you can't turn on social media today without someone typically shirtless in a grocery store telling you that foods are bad. And you can, especially at PCOS, I think if you started searching for all the foods that you have to avoid according to the internet, you would be left with nothing. And I feel like that bubble is going to have to burst eventually, and people are going to start getting exhausted and being like, you know what? I just want to be healthy. I just want to feel good in my body. I just want to, tackle whatever this health issue is. I'm tired of being afraid of food. I'm tired of thinking that everything is going to kill me because it's not. And then like, so that's kind of why I was like, you know what? Like, maybe for right now, that's where my focus is like, how can I get you to not be so afraid of food, which is really challenging. A lot of people are scared of processed foods or scared of certain products, and you can literally take any product, including water, and really make it scary on the internet. So I
Yeah.
feel like the rest of my career is going to be begging people to not be afraid of food anymore, which is crazy because most people think that that's what I want to do is, like, dictate your meals and take your food away and all of that. It's the complete opposite.
Yeah, okay, wonderful, that's awesome, and, just in wrapping up here, I'm just wondering if, there are any like, I know you said the one thing that everybody should remember, but is there any, like, words of encouragement or words of advice you have as, like, on their parting words sorta thing?
Yeah. So the one thing that comes to me is PCOS is a beast. It's a really challenging condition to live with, and unless you've lived with PCOS, it's really hard to, like, know what someone goes through on a daily basis. There's so much that we deal with that you don't see. Um, but I do want to leave people with the, like, encouragement, because most of the time you're just getting, like, all the negative information about PCOS and, like, what it causes and what it does, and so on. PCOS, even though it's complex, it is manageable. So, like, you can manage it given that you have all the resources to do that. I feel like that's very empowering to know, is like, at least, like, it may be challenging to manage it. There may be seasons of my life where I can't do all of the things that it demands of me, but it's really empowering to know that there are things I can do about it. And I just really want to share that with as many people as possible of, like, you can do so much to help manage PCOS. There's a lot more out there to help you, and you don't have to do it all today. PCOS, it's not going anywhere. Take your time. I do think that some people get burnt out with trying to address their health issues. I'm sure that's across the spectrum of all different health issues. You go through that phase. Take breaks when you need to, and then just keep going when you're ready, because there's so much that you can do. There really is. And you can have a full, healthy, happy, quality life despite having PCOS.
Amazing. Yeah. And where can people find you?
Yeah, so right now, Instagram's kind of home base for me. I am Endocrine Collective, which is my Instagram page. Also, endocrinecollective.com, but I'm most active on Instagram.
Amazing. And it will be linked in the description. So everybody will be able to copy and paste,
Awesome.
click, all that stuff.
Yeah.
And my very, very last question that I try to ask everybody that joins is, and it does not have to be anything health related, chronic illness related, PCOS related, but is there any shows, movies, or books that you're really into right now?
Ooh, okay.
I'm always here
So
for recommendations.
yeah. Um, I am a huge I read a lot, and I like the darker things, which I know is not everybody's flavor. So I do love thrillers and horror books. And the book Tender is the Flesh is the last book that I've read, which is on horror, so don't read that if you're queasy. But it's just gonna go down as probably one of the best books I've read all year. So yeah, so I'll just share that.
Yeah, no, we're always here for recommendations.
Yeah,
I
yeah.
always love hearing what people are into.
Yes, mhm.
Wonderful. Okay, well, thank you so much for joining me. I do
Thanks for
appreciate you
having me
taking the
on and for
time.
letting me share my story and to talk about PCOS.
Of course.